Hello, myself Dr. Rajesh Gasra. I am MBBS, MD, DM Nephrology. Has done my all degrees from the SMS Medical College in Hospital Jaipur, Rajasthan, and presently working as a consultant nephrologist at the Metro Mass Hospital, Jaipur, Rajasthan. Today I will be telling you about little bit about the kidney and its function in disease and other things about the kidney. Now first come, what is the kidney? Kidneys are very small organs situated in the body and 2 in number. And as we know that it is although small but very important vital organs of the body. As they function, coming to their function, what is their function? They remove the waste products from our blood like the filter, and they also remove the excess fluid from our body and also help in the blood pressure control, also in the formation of many hormones like which help in the blood formation, also vitamin D formation. There are many functions and vital to the body. Now come to the kidney failure. Why does the kidney fail? What are the causes of kidney failure? Most importantly, in our population, in all the world, it is diabetes the predominant cause of the kidney failure. Apart from that, hypertension and the other recurrent kidney infections, stones, or any congenital malformations of the kidney can lead to the kidney failure. And apart from that, very common thing is that painkillers and any other medications, indigenous medications, can lead to the kidney failure. Now come to the how we diagnose the kidney failure as a patient with symptoms of kidney failure. The usual symptoms are either swelling of the body, decreased urine output, generalized weakness, or the decreased appetite, or the nausea and vomitings, or the difficulty in breathing may be there. Apart from that, change in the urinary habits may be there, change of the sleep patterns may be there. All these can indicate the kidney failure. Now come to the what are the types of kidney failure. Types of kidney failure, either it may be acute kidney failure or it may be the chronic kidney disease. In the acute kidney injury, it is only an acute deterioration. It is a rapid deterioration of the kidney function and caused by many different causes like the infections, any other dehydration, or any other medications can cause like this. But the most important is the chronic kidney disease. That is the permanent and irreversible failure of the kidneys. That is the more important, and we concentrate on the chronic kidney disease further on. Then comes the treatment of kidney failure. What should we do? For the treatment of kidney failure, there are treatment like diet control, drugs, the dialysis therapy, then the transplant. So we come to the one by one. What about the diet? Diet is a very important aspect of the treatment of the kidney failure. As every person has queries about the diet, so diet changes as the kidney failure progresses. So we should consult the doctor, follow the advice of dietitians in the kidney failure cases. And the most common things are that usually patients with the kidney failure require low salt diet, low fat diet, and also they have to see the potassium in their body. So they have decreased potassium in the diet. So the food which contain more potassium should be avoided, like the guava, citrus fruits should be better avoided. And apart from that, phosphorus is an important thing, and which the patient should undergo the phosphorus, less phosphorus diet. And phosphorus is a source come from the either dairy products mainly, or the leafy vegetables are the rich source of the phosphorus. So we should avoid them also. And apart from that, protein intake. As the kidney failure progresses, CKD progresses from one stage to the other, the protein requirement of the body decreases. So the patient should be instructed to decrease the protein intake according to the stage of the kidney disease. And for these all dietary changes, the patient should regularly follow the doctor and dietitian advice. Next comes the drugs. Though there is no particular drug to improve the kidney function, but there are many drugs are required as the kidney function deteriorates to improve the well-being of the body, like to improve hemoglobin, like to improve the calcium, like to control the phosphorus. Many drugs are required which are prescribed by the doctor, and you should take the follow-up of the doctor regularly. Then comes the dialysis. What is dialysis? It is the artificial means of filtering the blood, so that the kidney is not functioning, so we should do some function by the dialysis. And dialysis of the two types. Either it is a hemodialysis, which is done on the machines at the hospital, or the continuous peritoneal dialysis, which can be done at the home with the help of one catheter inserted into abdomen of the patient. So we talk mostly of the hemodialysis or as a dialysis as a whole. Dialysis is a technique used to remove the waste products from the kidney, from the blood through the dialysis machines. So patient has to go to the hospital 2-3 times a week for the dialysis sessions, and in that also in the hemodialysis blood loss is also there in sometimes, so patient may require sometimes blood transfusions and other medications. And in the continuous dialysis therapy, at the home, patient can do dialysis by himself after the proper education and having the proper aseptic measures. You can both. And dialysis is the requirement when the kidney fails to the end stage and kidney cannot function altogether. So the kidney function can be at least to some extent can be done by the dialysis, but not fully. Dialysis cannot do the full function of the kidney because it can only filter the blood but cannot do other things like the blood pressure control or other calcium, vitamin D metabolism or any phosphorus restriction. They all cannot do by the dialysis. Then comes the most important therapy of the kidney failure, chronic kidney failure, is transplantation. That is the kidney transplantation, which is the best option for any permanent kidney failure. What is the transplant? In the transplant, kidney from a healthy person is transplanted to the patient. One kidney is taken from the healthy person and transplanted into the patient by a operation, surgical operation. In this, who can either issues come, who are the donors, what should donors problems, these issues usually come out. Donor can be any healthy person, but preferably a blood relative and below the age of 60 years is a preferable donor, because the kidney taken by the blood relative is usually function good than the other unrelated kidneys. And regarding the donor issues, there is no issues as such to the donor. Any side effect is not there. He has to undergo a little surgical operation. Only the operative risk is there. Apart from that, there is no other risk, because the donor is before transplant properly evaluated, all health checks are done, and then the kidney is removed. If the kidney is found to be good functioning, both the kidneys if are good functioning, then only one kidney is taken from that. And in the long term, you can say that only side effect is in the long term. Sometimes the donor may develop the mild hypertension and the protein excretion in the urine may be there over the long half-life of the donor. Apart from that, there is no issues regarding the donation. And regarding the prevention of kidney disease, how can we prevent all these? For the prevention, the most important thing is awareness about the symptoms, because most of the people don't know what is their symptoms relating to, so they don't come to the nephrologist directly. So we should know what are the symptoms of the kidney disease and to avoid them. Like we should notice, any particular person should notice any change of urinary habits and immediately consult to the physician or the nephrologist regarding that. And any other medications, any painkillers should not be used over the counter, so that they can cause the damage. And we should properly see if their congenital malformation detected at the childhood, the patient should undergo the regular follow-up with their doctors, so that the permanent damage can be avoided, because we can only retard the progression. If the kidney has function deteriorated, we cannot fully stop the function deterioration, but only can retard the progression. So we should be aware of all the symptoms. Then change of sleep patterns, decreased appetite or generalized weakness, they should consult the doctor and should undergo the health checkups. And apart from that, these urinary infections, if they are got, they should be properly treated and properly followed up, so that and once they got the diabetes or hypertension, they should go for regular checkups, undergo regular examinations as advised by the doctor, and should go to the nephrologist at the proper time, so that the disease can be retarded at the proper time. Progression of the disease can be controlled. Thank you. I hope this video has helped the patients to get the awareness about the kidneys. Thank you very much.